Total ankles are something that's been around for several decades, and they started early on in the 70s or so, and admittedly the early models or the early generation of the total ankles were not excellent. So they kind of went by the wayside and they kind of faded away, and that made basically an ankle fusion procedure kind of the gold standard for ankle arthritis. And I think that has changed over the last several years, in that as the newer generations of total ankles have come about, it's become much more prominent in the orthopedic foot and ankle community as far as being an option for end-stage ankle arthritis, with the percentage of ankle replacements being done per year really skyrocketing, especially over the last decade or so. An ankle replacement is similar to what probably most people know about, which is a hip and a knee replacement. They're very similar as far as the idea. When there's end-stage arthritis of a hip or a knee where the cartilage is wearing off and people have pain and issues with function, limitations in stiffness, essentially the joints get replaced with metal components and plastic components and some combination to be able to kind of recreate the joint. And the idea is, first and foremost, a pain relieving procedure. Secondarily, I would say it's a motion preserving or even motion improving procedure. Of course, we generally recommend non-operative stuff for as long as possible, with bracing and injections and medical management and activity modification. Walking is closer to normal with an ankle replacement compared to an ankle fusion. You can generally walk faster with an ankle replacement compared to an ankle fusion. The vast majority of ankle arthritis is related to trauma, so whether that be from prior fractures, or it seems that more commonly you're seeing people with chronic ankle instability, sprain after sprain after sprain, where that cartilage just wears off and they kind of wear out their ankles. So that's where a lot of that ankle arthritis comes from. But the big thing after an ankle replacement is going to be trying to get the skin to heal. So for me, that's 4 weeks of non-weight bearing. So the first 2 weeks are essentially being in the splint that I put people in right after surgery, then going into a cast for a couple more weeks, and then getting people into a boot and starting walking. So our number one goal is to get the incision itself to heal, and then afterwards the implants are stable when they go in. As people are getting going and they're working with therapy and they're getting stronger, they're feeling the fact that now they can do the things that they weren't able to do from just an activity of daily living standpoint, getting around. I'm always impressed at the motion that people have following these surgeries. I'm always impressed with kind of the exponential kind of improvement in their function once they have gotten through their therapy and everything.